The next item is in relation to our health committee. As has been a fixture at each of our board meetings, we will receive an update on health and safety conditions from our Henrico County Public Schools Health Committee. And so Dr. Tigan switching hats now out of finance and into health. Thank you. I'll turn it over to her.
Yes, good afternoon, Madam Chair, members of the board, and Dr. Cashwell. It's always nice to be able to come and bring some updates, especially when the data is improving and community spread is decreasing. The HCPS Health Committee met on Wednesday of last week and on Monday of this week. Our meetings got a little messed up due to the snow and ice. And the guidance, the meetings were really focused on the new guidance that has been provided to schools from the CDC and updating the committee members on the progress of the first and second vaccines for our employees and the refresh of the Health Updates webpage in preparation for greater numbers of students returning to in-person learning. The new guidance from the CDC contains some of the elements we are quite familiar with while reassessing the community metrics schools should focus on. The three essential elements are the layered mitigations. There is no changes here. It's still focused on everyone wearing a mask, maintaining 6 feet of social distancing to the greatest extent possible, washing hands often and coughing and sneezing into our elbows, frequent cleaning and disinfection of high-touch areas, and a focus on contact tracing. The risk of community transmission, you might recall that in October, the guidance shifted from 5 levels to 4 levels of returning to school and went to a 14-day summation of data. Now it's changing to a 7-day time frame and 4 levels. And so I'll show you what that looks like in just a minute. And then so the phased learning modes, really focusing on offering virtual options for students and staff, and it's very dependent on the community transmission levels, and talks about differences between elementary, middle, and high, as well as athletics and extracurricular activities versus academic activities. And as you can see from this graphic from Tuesday, 2 days ago, the burden levels for Henrico have been trending down for both the daily case incident rate per 100,000 persons and the 7-day moving average percent positivity. And that trending down has been over a month. So each day for over a month, we've seen downward trends. And using the new guidelines, we can see where we are with regards to the risk of community transmission. And so here is a visual of what the thresholds for community transition are and what that will mean for schools. The total new cases per 100,000 persons in the past for Henrico on Tuesday would indicate moderate transmission, while the percent of nucleic acid amplification tests, that another new term they're throwing into us, but the PCR is just one version of this, was at substantial transmission. I will tell you, between Tuesday and Wednesday, we saw a decrease where the total number of new cases per 100,000 went from 24.6 down to 21.7, still keeping it in that moderate transmission level. But I can tell you the percentage of the nucleic acid amplification test, the percent positivity went down from 8.2% to 7.5%. So if I was creating this presentation yesterday, we would have seen both of those two major metrics in the moderate transmission level. So based on that, when we look at what does that mean for the new phased learning mode, we can see that while On Tuesday, when this was done, we were between moderate transmission to substantial transmission, since we had one of those two major factors in each of those areas. Today we would be in the moderate transmission, all in that yellow area. But where we're seeing schools implementing those 5 key mitigation strategies, looking at K-12 schools being between full in-person instruction with 6 feet social distancing, to looking at elementary schools being in a hybrid mode, middle schools and high schools being in that same hybrid mode. And you see the slight difference between on the athletics and extracurriculars, where under the moderate transmission, it's really talking about wearing masks and physical distancing, whereas in the substantial, they're really talking about only looking at outdoor sports. And so you will see that where we are right now with our kids returning on Monday, having our pre-K through 2nd graders back in our buildings 4 days a week, knowing that on Monday we're bringing back our 3rd through 5th graders, our 6th and 9th graders, we are right on par. We have we're in the middle of fall sports right now, and so we are quite well aligned to this new guidance from the CDC. And so, one of the other mitigation factors that we have been able to provide to our staff, in addition to the 5 key mitigation strategies, is really getting them the vaccine. And so as of last Wednesday, we had nearly 7,000 employees, both full and part-time and temporary, that had received their first dose of the vaccine, and 462 had already received their second dose. And we continue to work with those who have missed their initial appointment due to having to isolate from an exposure, as well as our new hires to get them vaccinated. We had over 150 employees on our wait list earlier this week, and we were finally given the green light to be able to bring them in on Wednesday. And so we continue to work. That list continues to grow and change as additional hires are made, or in some cases, people have requested the vaccine where previously they had not for whatever personal reasons. And so I think that list earlier today was back up to 50 employees on that wait list, and we're hoping to get them in on Friday, so tomorrow. And so that's where we stand currently on the vaccination front. And now I'd like to turn it over to Mr. Andy Jenks, as he's going to give you more information on, we told you we were updating our health updates page. And so, Mr. Jenks, I'll turn it over to you.
Beth, thank you very much. The school division's commitment to public notifications and reporting of positive COVID-19 cases is ongoing. Dating back to last August, any time an individual who had been on our property reported a positive case to us, we listed that case as well as the last known date that the individual was in one of our buildings, campuses, or offices. And for the folks who are listening at home, you can still find this today by going to our main website, which is henricoschools.us, clicking on Health Committee Updates, which is listed under the section known as Hot Topics on the left-hand side of the page if you are using a desktop computer. The aggregate list, of course, is in addition to the school-based notifications that went out from a principal every single time. As of this week and next, a number of updates and changes have gone or will go live for our employees, families, and the general public to see. For example, we will be reporting new data based on increased in-person learning, updated weekly, not just for classroom instruction, but also athletics and extracurricular activities. This would include the number of positive cases, the number of close contacts associated with those positive cases, the number of outbreaks between students and staff and students, as well as the locations where those positive cases were reported. Also posted under Hot Topics right now, we've been updating and communicating the existence of resources that include our new video toolbox, which includes short clips on topics such as a clean and safe bus ride, self-screening and a check of your symptoms, improvements to air handling equipment, wearing your mask, new desk cards, signage, and stickers, personal protective equipment for students and staff, and a day in the life of in-person learning. Aside from the web, the messages are being emailed and posted to our social media. Schools themselves are aware of these resources too, to be used at their discretion. In addition, this week, our elementary schools received a supply of flyers, magnets, window clings, and door hangers to remind students and families of the self-screening process that we ask for every morning, and those items should start arriving in homes as early as next week. We will continue, of course, to add to this material throughout the school year. And with that, I think I can turn it back over to Beth, but I will remain close by for any questions.
Yes, thank you, Andy, and thanks for all you've done in your responsiveness to the Health Committee's request. So we're happy to answer any questions you might have.
Okay, board members, I'll throw it over to Ms. Atkins first. We'll go this way this time. Ms. Atkins?
No questions at this time.
Thank you. Reverend Cooper?
Well, thank you, Madam Chair. So our paradigm has shifted, right? As of the 22nd, we've got students back in the buildings, staff back in the buildings in mass numbers. So I kind of been reflecting, and I want to take just a moment real quick. The toll of the coronavirus on our schools and leaders and staff has made a lot of changes, and I just want to commend our staff members. I want to echo what our county manager said when he said that Dr. Cashwell was the best superintendent of the Commonwealth of Virginia, end quote, John Patokis. And I want to also thank each member of our division leadership team, school building staff, nurses, community who help with our vaccination efforts, IT for keeping everyone connected, cleaning professionals in our schools, and in his team for communication, family engagement, and anybody I've missed, I just want to thank you. But Dr. Tigan, as you have shared with us the layered mitigation strategies from the CDC, I want to focus on 3 issues quickly, referencing social distancing, universal masking, and PPE and cleaning protocols. I've been getting many questions from teachers and staff with concerns concerning protocols that may or may not be universally applied throughout the division. Each school has its unique challenges and needs, we understand, but I want to make sure that the standards for ensuring the health, safety, equity applied at all schools. Many of the questions that I have been asked are reoccurring. First one, in regards to PPE, are the principals at each school responsible for providing PPE for the teachers and staff? Is that the expectation?
We have provided like 2 masks for every cloth mask for each one of our employees and each one of our students. We also have extra supplies on hand. There's actually a COVID liaison in their building that is really responsible for what the inventory is of the PPE and making sure that there's sufficient supplies within the school for visitors as well as our students who might forget a mask now and then, a teacher, or you might have a mask and something breaks. And so we have those materials there. We have them, some of the same things on our buses where they have extra masks and also hand sanitizer, wipes, things like that.
So along with the masks, are we providing the teachers with the cleaning materials for their classrooms?
Absolutely. They have cloth wipes that are the appropriate level of alcohol content. They have hand sanitizer. There are refills within their building to be able to access more. So if they need something, they just need to ask their liaison, and Courtney Berry and team will get the supplies to the school.
Thanks, that's great to know. So now with the CDC recommending that 6-foot distancing, speak to me in regards to the 3-foot distancing on the buses. Talk to me about how that's going to look and work as our kids go back.
Actually, on the bus, the way they go back and forth, there is that 6-foot distancing, the way they alternate between seats. So I don't know if Mr. Pritchard's here. I'm not aware that.
I think I can cover some of that. We certainly are following the CDC guidelines, and I know Mr. Ellis and the transportation team arranged our bus seating accordingly. I do know that because of the duration of time and the situation on the bus, some of those guidelines look different through the CDC guidelines than the guidelines they publish for classrooms, where kids are spending longer amount of time together. But where we have seen some variance there is where children, or students rather, who are in the same same household, whether they be siblings or not, may sit next to each other. And so it might be that someone sees kids sitting on the bus closer together than the distancing seating charts, but please know that the bus drivers have allowed that based on the way students reside in the household. And so in cases where that mitigation strategy might not be in play, that would be the reason.
Well, I think that's great to note, because if I'm riding down the street and I've been cognizant of the distancing requirements, and I see children on buses, sitting next to each other, I would assume that the mitigation strategy is not being utilized. So thank you for clarifying that. So Dr. I can speak to, I know at one point we talked about children eating lunch in classrooms. Well, I've heard one teacher sent me a question saying that they were asked to take their children to the cafeteria next week based upon lower enrollment in their classes. Is that true?
Some of our schools have requested the use of their cafeterias where they've put desks in them with these same, desk barriers on them. It is very dependent on the number of students who have chosen within a school or within a grade level to be in person. And so while that's not an across the board, there are some schools that are able to do that. Yes, sir.
And I would add a point of clarification in addition to what Dr. Tigan has shared, that, when we think and we wanted our families and our students to understand that traditional cafeteria dining is not in play, that's still true. And that comes from the way not only the meals were provided through a cafeteria line, if you will, but also this idea of a mass or a large group. And so because of the recommendations and mitigation strategies that don't allow for that large number of students present in one space, that's why we say cafeteria dining is not taking place as usual. That doesn't mean you might not have students dining in the cafeteria in a smaller number and distanced, but what you likely wouldn't see is, or you should not see, according to our plans, is traditional meal service through the cafeteria lines and a packed cafeteria of, multiple grade levels of students, though that space itself may well be utilized for dining, for a classroom, for any number of things with the mitigation strategies in place. And in some, as long as they don't exceed that large number of students, they may have a couple of classes eating in that space distanced.
Again, I think it's a great point of clarity, because it's very easily to misinterpret that we said we would not have children eating the cafeteria context, but not saying we're not using the cafeteria. So real quick, also in this same vein, many of us have been following what's been going on in the state legislature in reference to local school divisions, specifically SB 1303 that passed the House and the Senate. If the governor signs that, what's that going to do to Wellness Wednesdays, which basically the bill says that we have to have 5-day in-person schools? What would happen? How are we on that?
The language in that bill, as I understand it, takes effect for the next school year term, though largely our practices are in compliance with what's proposed in that bill as it stands today. I think for us, the challenge is going to be if we still find ourselves in a place where these mitigation strategies are still recommended by the Virginia Department of Education through CDC that ask for 6 feet distancing, the distancing on the bus. When you talk about the potential of your entire student body coming back for in-person learning, you can't also use those mitigation strategies and serve that number of students in person. So I think we're still, thinking through what the impact is and how to deliver that in-person instruction, but also adhere to the mitigation that may well still be in play as we go into that time frame.
Well, I appreciate that. So I'm assuming that's going to be more to be determined, huh? Well, last question for me. Thank you, Dr. Tigan and Dr. Cashwell, for kind of tag team. Quick question. So can you speak to when we made the change to the meal distribution, I think March the 10th, it goes to effect. So I guess I've had some questions raised with me in regards to persons having difficulty with 1-day bulk meal pickup. Some families have limited transportation, no transportation at the time when curbside's available. What are we doing? Are we doing anything to kind of figure out ways to help families in which this change has impacted them negatively?
At this point, we have planned the 1 day as we're transitioning kids back into school and working on our transportation schedule. I mean, it's something certainly that we can continue to look at as we get a better handle on resources once we know that kids are back in school and a routine is kind of established in the next 2 weeks. So we'll go back and look at it. But right now, this was based on the resources we have and what we were anticipating. So that may change.
Okay. Thank you, Dr.
We'll take that under
Madam Chair,
consideration.
thank you so much.
Thank you, Reverend Cooper. Mrs. Shea, did you have questions?
Thank you, Madam Chair. So I look at these numbers every day, and it brings me so much delight to see the graphical representation of those numbers. I'll use the word plummeting, and with a continuous trend downward. It's really fantastic. Can you talk to us a little bit about, so in our previous metrics, we were looking at the total number of new cases per 100,000 persons within the last 14 days. That was a sum, correct?
Yes.
And then how does that compare to now that we're looking at the daily incident rate per 100,000 over 7 days?
And they're looking at like an average, so it's a sliding average. So each day you'll take the last 7 days, divide by 7, then take the next. So as each one goes down, you see the trend go down as well.
So now we're looking at an average?
Yes.
Perfect. Okay, I just wanted to clarify that because I know as this process has gone on, as we talked about at a board meeting prior this month, whenever that was, they voted together, Henrico has continued to follow the latest guidelines from the CDC and the VDH. And I know that has caused a lot of frustration with constituents that have opinions on both sides of this matter, that the goalposts are moving. But I just want to be really clear, Henrico, unlike some other localities, we have never reverse engineered these metrics to have the outcome that we want. We have used the metrics that have been put forth by the health experts and followed them, correct?
That is correct.
So this is just another example that as we learn more about the science and the transmission, and as the CDC further refines what they're finding to be most important to safety, this is just a refinement of it, and we're going to follow it.
Yes, ma'am.
Fantastic. And then, so as we continue to monitor this, I mean, I'm just like tickled yellow, we should say, that we are finding ourselves in the yellow. If we make it down to blue, and you know, this is obviously a hypothetical question, but if we make it down to blue, could that impact our in-person offerings to be perhaps less restrictive for the environments there?
As far as social distancing?
Correct. Or
Again,
maybe recess, or, you know, some of those extra pieces.
Well, and that depends on what the advice is from the CDC and the VDH as
At that
we
time.
keep going down. Yes,
Okay.
ma'am.
All right, well, we will continue to follow. And again, I'll repeat for those listening, we have not reverse engineered any of this. We have not let politics decide what we want the outcome and reverse or engineered our metrics. We have used those passed down by CDC and VDH and those who frankly know more than all of us do about epidemiology.
Well, and I think, you know, as time has gone on, there's more data from which that they can draw from. And so while it can be really frustrating at times that there are changes, it's understandably so because there was limited data in the beginning. And so now they have a lot more data which to make a more, you know, to ground their decisions in.
Absolutely, and that's how science works.
Yes, it is.
And then my last brief comment is I want to just thank Mr. Jinks for adding, when we look at the new tracing and data on cases, for not only having cases, but also the contacts. I think that's really informative. It's informative for me, but hopefully for the public on how well our mitigation is doing. I know it can be jarring to get that email from your principal that there is a case in the building. But the fact that then, you know, most frequently when there is a contact, that contact is then not turned positive, that right there is evidence that our mitigation is working and our mitigation is strong. And so I think by adding those contacts, it tells the whole story of our mitigation and our safety and our dedication to the safety of our students and our staff. So that is all from me. Thank you.
Thank you, Mrs. Shea. Ms. Kinsella, did you have anything?
Yes, I just have one thing. I know throughout this time, traditionally amidst our health committee updates, at times we've also had instructional things brought forward. I know a lot of what I've heard, my colleagues have already covered the science and health part. But I actually would like to know if the board is going to have an update, perhaps maybe at our March 11th meeting, as to instructional items. How is it going in our schools? How is it going for those students attending virtually versus those in person? And so that we can share information about what we're hearing from our
Yes, ma'am.
constituents.
And if there's specific things, please feel free to let us know, and we'll make sure it's included in the presentation.
Okay, thank you.
Ms. Kinsella will, directing the superintendent to add that to the agenda right now.
We will absolutely add that.
Because that wouldn't be part of the health update, it would be
And I think rather than including it with the health update, we'll go ahead and separate that. But you're
right.
right, we have included a lot because it goes hand in hand. This health situation has influenced our instructional practices, and so I think we're at a place where we could sort of separate those conversations, and particularly now that we have both in-person and virtual learners, provide this board with an overview of where we are, what we're seeing as some successes and challenges. And if there are any specific questions you all would want us to address at that time, please don't hesitate to let us know. We'll include that.
Thank you.
Okay, great. Anything else, Ms. Kinsella?
That's
Anything
all I
else,
had.
board members? Thank you, Dr. Tigan. You can put
Welcome.
on a different hat probably to come up here in a
I
minute.
think we'll give her a break for a moment.